So I'm with Deborah today, and what we're going to be doing is a demonstration of full face correction with filler. And the filler we're going to use today is Radiesse, which works very well for this. Deborah is a good candidate for filler. She's lost volume in her face, one of the issues in terms of aging. And what ends up happening when we lose volume is we lose support of the underlying structure, and then the skin starts to sag. And so what we're going to do to start is just kind of take a look at some areas on Deborah's face. We'll do some drawing to kind of show what areas have lost volume, and then once we've done that, then we'll begin with the actual procedure. So we're going to go ahead and start up here in the temple. I like to start at the top because as we add volume here, what it tends to do is pull the tissue up below, and then that will change the injection pattern as we move further into around the mouth. All right, you ready? Mm-hmm. So as I'm injecting, what you can see is that the area is starting to get volume back into it. So that hollow temple is starting to come out and starting to recreate that curve that we wanted to get that more youthful appearance. You can see the injections are usually fairly tolerable. So where we're placing the filler now is just right above her eyebrow. And again, we're trying to recreate for her a nice smooth contour. So now one of the things that we do with filler is once we get that in, actually mold it. So in a sense, it's almost like sculpting the face to get the contour that we want. So you can see now how we have a much nicer curve kind of going from her forehead down all the way out into her zygomatic arch area. Nice smooth area coming right down here to the orbital rim. So we probably can actually use just a little more volume here, so we're just going to go ahead and do that. So we're going to sculpt that in. How are you doing, Deborah?
Good. Really good.
So now if we look from side to side, you can see what a nice difference that is in terms of the appearance here. So this is a much more youthful appearance, much smoother, much more of the natural curve, that one smooth curve that kind of goes right from the forehead down here, right from the orbital rim up in here. And so that really helps to kind of smooth things out and rejuvenate that upper face. What we're going to do now is we'll go to the other side and do the exact same thing. Alright, so now you can see that we have that nice curve kind of moving down from her forehead onto her zygomatic arch, just like that. And again, up here on the forehead, we're seeing that nice curve going from her orbital rim all the way up to her hairline. So that's really what we want to see with this injection, is a nice, smooth, easy transition from one aesthetic unit to the next. The idea is for this to all look natural. So here we've placed how many syringes? 5.
Yes.
5 syringes in, and you really can't see the product anywhere. It's a nice, even transition, and really a very nice, natural look. So the next area that we're going to move to is actually right here. So what we're going to do is we're going to get volume back up into Deborah's cheek, and that's going to lift the whole cheek up, and so you'll see this volume start to come in right into the lower eyelid. You'll see this area round up. Again, what we want to see is a nice, smooth, even curve. So So it goes from the lower eyelid right down into the top of the upper lip. And you can see here how Deborah has a curve to start, and then a depression, and then another curve, and then it kind of flattens out in here. So we're going to correct all of that. So you can actually see as we add that volume how it's filling in that depression, and it's really lifting all of that tissue up. And you see just with that one injection, what a huge improvement we have. So we've already, you can see, corrected a lot of that that flattening that she had, and a lot of the depression that she had into the upper, actually into the lower eyelid. Right. Now what we're going to do is basically come right along. We're going to add some volume right along the zygomatic arch to give her that nice curve, give her back a nice high cheekbone, which she had when she was younger. So just say we lose volume here, kind of square off, and what we're trying to do again is add volume back to the upper face so we get more of that heart shape, much more youthful appearance. And so as we get that volume back, you can see that all these wrinkle lines that she came in with are all starting to flatten out, and that's that volume coming up from below and starting to stretch that skin back out for her. And again, you can see how we're starting to get this curve that comes all the way around. So remember how we had to start, we had high and then low and then high and then low and back to high again. And now you can see all of those depressions are really pretty much all gone. And so we've got this nice even curve. She's got nice high cheekbones again. And so what we're going to do is continue to basically blend down to get all of these areas to kind of work harmoniously together. All right. So now we've done the temples. We've done the transition area, we've done the mid-face and the cheekbone here, and you can see how that really is starting to change the whole aging process here. We're giving her back that youthful volume that she had before, and you can see a very nice natural look. You still don't see any signs of filler, and certainly that's really important. And it's a nice even transition. So what we're going to do is move to the other side, and we'll do the same thing. And again, you can see as I inject it, it gets that volume right back up, and it starts to efface that tear trough. See how as we add that volume now, again, we're just getting that nice curve that goes right from the forehead, right across the temple, down into the cheek. See that it really kind of evens things up nicely. So the next area that we're going to add some volume into is right along the base of the nose. We're going to get some support here. We're going to get rid of this deep nasolabial groove. So, just get a little bit of sting right here. What that's going to do is give her some support back to the base of her nose. And kind of even out this nasolabial fold. We're going to come in here and basically kind of fill that in. This is more traditional use of the filler. And now if you look, you can actually see how the nose on this side is actually better supported than the nose on this side. You can see that we've got more volume in here, and that's lifting the nose back up. So we need to go back to the other side and even things out. So the next area that we're going to take care of is the area right in front of the ear, and that's going to help to kind of widen things out a little bit. And again, what we're wanting to do is get back that nice heart-shaped face. So now what we're going to do is move down here to the jawline and the jowl. Alright. And what we want to do is basically give Deborah back a nice smooth jawline, kind of moving from the ear all the way down to the chin. And you can see how as that volume comes back into this area, that jowl starts to disappear. That area becomes more and more smooth. Yeah, that really improves the jawline there, and really kind of even things up nicely for us. Good. We're almost there. Just a little bit. Okay. All right. So, so we're all done, and we've basically started at the top. We kind of filled in this nice curve going back down in here, nice curve along the jawline again, and both sides here. We re-elevated the tip of the nose, gave Deborah back some volume back into the cheeks here, into the lower eyelids here. She's a little bit swollen here, and with this kind of procedure, you're going to get a little bit of swelling. We've done actually quite a bit today, and we'll have Deborah iced down, but overall not too bad. All right, so all set.